So without further ado, let me give a warm welcome to Yutaro-san and also Ching. I'm going to hand over to you guys. It'd be great to hear a little bit about you and your venture. Ching, maybe you could start us off, please.
Thank you, Matt, and good afternoon, everyone. Excited to be here. So my name is Ching, CEO and founder at VoltDragon. We started in 2013, and today we serve providers, payers, and even some of the labs and radiology centers across 6 different markets. They are Singapore, Thailand, Cambodia, Taiwan, China, and Indonesia. Yeah, and the 3 pillars of our solution include an EMR system that's connected with other stakeholders in a sort of like connected healthcare app ecosystem. And the second one would be a patient app. And the last one would actually be, we have a separate team for data solutions.
Right. Okay, thanks, Ching. You're covering quite an interesting set of products there. So I'm really looking forward to hearing more about that in a second. Yutaro, over to you.
Okay, thank you so much, Matt-san. So hello, everyone. I'm really very grateful for such a wonderful opportunity to speaking in this summit. And then my name is Yutaro from miup company as a COO. And then quickly, I just want to share one of my document that is explaining about the miup company, what we are going to do. So our company is based in Japan. And then besides, we are also doing the business in Bangladesh. And then mainly we are focusing in Bangladesh. Then what we want to create in Bangladesh is a healthcare ecosystem, which is showing in the slide. Could you see my screen now?
We can see it, yeah.
Okay, so what we want to do that in Bangladesh is try to make a seamless ecosystem in the healthcare. It's collecting the data from the prevention to the diagnosis system as well, and then also when patient is illness, and then also taking the medicine. So from the entrance to the end, we are collecting the data, and then also beside providing the healthcare management system. And then especially what kind of technology we have, I also want to show about our technology, what we have. So this is what we are thinking to provide a service to Bangladesh's people, in Bangladesh market, is low-cost health checkup system. So in Bangladesh case, there is a shortage of medical profession. I think not only Bangladesh. So that's why we are try to providing those kind of a health checkup system to the people in Bangladesh. And then that is the cost is minimized 50% to 70% cost reduction system. So what we are thinking to provide. And then actually those services, not only those services, we also going to provide the healthcare management system as well. So later on, I'll try to explain a bit more detail about that. So thank you so much.
Thank you, Yutaro. So gentlemen, perhaps we can roll back a little bit and just go back to really thinking about your ventures and what are you trying to solve. So I think you've both been in market for a number of years. It'd be good to hear about how long that's been actually in a second. But when you first started your ventures, tell us a little bit about the pain points that you were observing, and how is your solution helping, of course, to solve those pain points? And maybe a little bit about what you've learned on the way as you've tried to solve those. I'm sure there's been lots of learnings. Ching, maybe we can come to you first on that.
Yeah, sure. Thank you. So VoltDragon started off in 2013 as a logistics tech company, but very quickly we kind of like pivoted into that of digital health. And actually what we were seeing is that I did spend some time in the US, the Valley, also in North Carolina, where you have like the Blue Cross and all these are located. So I've seen a lot of the application of how interoperable kind of patient records, or even just having a digitized medical record can have its application and can help with the way that healthcare is being delivered. And that kind of resonated a lot with my personal story where, because when I was younger, my mom had breast cancer, and it was between like stage 0 and stage 1. And we were looking for second opinion, but although the doctors is just right across the corridor, but we have to do all the tests again, you know, and the anxiety of waiting for the test to come back, and knowing that the longer that we wait, the chances of being a stage 1 is much higher. So that could actually very much be reduced if there's just some way that the medical risk can be interoperable. And fast forward by like 20 over years, looking at when we first started the venture, and even the regional some markets now, like although there are a lot of talks about, you know, like AI, machine learning, you know, like, you know, actually having like a really useful like consumer facing app that can give a protocol on the right nutrition, maybe also to like possibly help on the provider end, helping the provider to make better decision, having that decision support. But to me, and just looking at the market, the basic or the fundamental issue that has not been resolved is that all the data are resided on paper or in silo systems. So before we can even, you know, move to the application that we like sort of aspire to, like for us, like Bowdragon is really doing how we see ourselves is we are really trying to do the dirty work of moving things that are offline to online. And for those medical records that are online, we want to make sense of it, not so much as to analyze it, but to actually put it in a way that we kind of clean the data and making sure that with the patient's consent, it can be shared. And before we can go into like population health and all that, at least at the beginning, we are able to connect, you know, the provider to the patient, to the lab, you know, even to the pharmaceutical company, to the employers and insurance company, third-party administrator. So kind of enabling this limited sharing or limited operability of the records to, you know, save costs, you know, to increase the quality of care. And we know that by doing this, we will be at some point reach the critical mass that will actually allow, again, with the patient's consent, those application that we dream of, you know, having that disease specific, you know, kind of like app or decision support, or even just, you know, triaging protocol, or even saying like, I mean, in the States, you have like precision medicine and all that. So we are really that extraction and like harmonization of the data. And of course, putting our system in each of the providers, the labs and all that, so that they have certain way to kind of like share the data securely and consolidate it at the patient end.
Lots of questions there that I can think of immediately. One of the most basic ones is, I'm British, and there's a bit of a joke in the UK about the quality of the doctor's handwriting not being very good and not being very legible. Just give us a sense of that digitization, which is really the foundation of what you're trying to do, all of that offline. How complex was that? Could you rely on, you know, OCR, character recognition, and how much of it was kind of just manually trying to translate written stuff into a digital record?
Right. That's a really, really good question, actually. I think it's a perennial issue that, like, I think for the doctors themselves, sometimes they cannot even read their own handwriting. Yeah. So what we did, so like, I think if you can just think of it kind of like how Google Maps actually kind of like digitize the street views. So like in the beginning, they are kind of like just taking photo of the street with the 360 camera like mounted on a car or like on the person's back. Yeah. And after they add like layers of data, and they even like open it up to like, okay, for the businesses to claim, you know, their business, for the like people to give review. So that's actually this exact same journey that the Bowdragon has been taking. So back in 2014, 15, we were scanning, and we still do. We were like painstakingly scanning every single page of the medical record. we try to kind of like transcribe as much of the indexable data as possible, like the national ID, the name, but those things stay as high resolution images, and we allow the doctor to assess them in real time, in a way that's properly categorized. So there is that kind of like a seamless transition from how they were looking at it on the paper to how they will see in our system. And to add to that, like we actually developed kind of like a annotation like a software on top of our EMR system, so that like they can continue to just see the scanned medical record, but now in a digital format, and they can continue to write on that. And we try to kind of like encourage or like provide a really like intuitive system, such that the doctors are slowly, or the users are slowly convinced to type and write less. But because we started off as like specialists, and specialists are generally more senior doctors, some of them started practicing even before the first Macintosh was built. So so for the new doctors, they will type, and they can type very easily. For the specialists, for the senior doctors, for the notes, they will continue writing, but we slowly ask them, okay, maybe that's like a super easy way to take an ICD-10 code. There's a super easy way for you to, just dispense medicine, reorder medication, and all that. So it's kind of like it's a journey, right?
Yes.
And having that structured data in, and as to the, okay, Len, can we actually give some of this consolidated piece of information to the patient? That's the same as, allowing the businesses to own their spot on the Google Maps and adding layers of data, because it's kind of like the like if there's not enough data in the system, or there's not enough data that it's in a very easy to access in categorized form, then it actually adds a lot of friction, because we are not coming up against another system, right? We are coming up with the pen and paper system, and the pen and paper system is super elegant. Like it never goes offline, so like we were dealing with all this, but I'm happy to say that like the journey has been really fruitful, and now we have a system that are used by happy providers in 6 different markets.
That's great. I mean, that's a very interesting story there about how you've also taken the user on a journey, and as their experience perhaps has grown and they've got more confident, you're encouraging them to do more of the kind of direct data written inputs. That's fascinating. I want to come back and talk more about perhaps some of the challenges from a regulatory perspective in some of the markets, but let's hold that question for a minute. Yutaro, let's go to you. Let's hear about what is the problem that miup was looking to solve, and what have you learned over the last couple of years?
Okay, Matsu, thank you so much for asking about the question. So what is the problem in the market, and how we are going to try to solve about those kind of problems? I can highlight the 2 points of the problem. I mean, not only in Bangladesh, I guess, most of the emerging country is also facing the same problem. Number one is shortage of medical professionals. And then number two is, in this situation, how pharmacy works as medical part of the medical system. Then I'm going to explain a bit more about the shortage of medical professionals. Due to the significant stage or the shortage of doctor, the number of doctor per 1,000 people is 0.4. So that is a number in Bangladesh. It is less than 150 of Japan's national average 2.5, which meaning doctor number quite, significant shortage. And there's a number of medical workers, includes not only doctors, but also nurses, technicians, and local community workers. It's 6.1 per 10,000 people, which is less than the other country like Nepal, 6.7, and Bhutan is 14.6. So it is estimated that there is a shortage of 60,000 doctors, and then 280,000 nurses, and then 480,000 technicians. So that is a big shortage. And then many doctor works currently in multiple workplaces. Probably because there are less doctor. That is a reason. So after work at the hospital, most of the doctor in Bangladesh is going to, beside of the pharmacy, there is called a small chamber. I mean, it's called a chamber. Then working from 5 p.m. to 9 p.m. I'm a bit surprised, got to know about these things because they are working like a Japanese people. I mean, working until 9 p.m. from 8 a.m., I guess. So that is a big problem. So we are thinking to replace or supporting to those doctor. I mean, those kind of part of shortage, point of shortage. And then number two, in this situation, how pharmacy work as a part of medical system, that is very important things in Bangladesh. The number of pharmacy in Bangladesh is around 200,000. So I think you might not know image about compare with other country. Then in Japan is 60,000. So that is a huge number. It's more than triple score than the Japan. So that's why, which means Bangladesh pharmacy is being part of healthcare system, so that we cannot avoid to create the healthcare ecosystem. So then what we are thinking to provide in this situation, so first we are going to give empowerment to pharmacy because we are not trying to take their business. So rather we are trying to help their business. So just example, which I show one presentation document earlier, that is the AI symptom checker and the AI risk assessment system, which is helping for health checkup, which can reduce the 50% to 40% of the cost for health checkup. So just example, we are going to provide to the risk assessment system and also health checkup system by the mobile basis, I mean mobile application. Then people is going to come to the pharmacy more. Then pharmacy is going to get additional income as well. Then we need to take the patient to the right way to take a right step for the healthcare system. So that's why we are going to introduce those kind of patient to the primary healthcare system or secondary healthcare system, which meaning hospital or clinic.
Yeah.
So that we are thinking to create a system. So we are not only providing the services as management, health management solution, not only that to the clinic. Rather, we are going to provide to healthcare management system to pharmacy as well, and then tertiary level hospital as well. So it's really big picture. So it's really taking time, but currently is focusing to pharmacy in Bangladesh, which has around 200,000, and then also clinic, which is nearby the pharmacy. So first we are going to make a system between them. After that, we are going to connect those systems to secondary, tertiary level. Then luckily this year, we got the foundation and also investment from Japanese government. So that's why we are working on it. Then that is really taking time to get the insight from the market. So last 5 years, we are working on it. And then also beside, we have a clinical laboratory center because we need to get accurate data, I mean, blood data. So that's why we have a only choice to establish diagnostic center in Bangladesh. That is very unique compared with other Japanese companies.
Yes. Interesting. Okay. A couple of quick questions then. So it sounds like you're looking on the health checkup side, that's enabled with the patient or the end customer through a mobile application. And then you're looking to make sort of connections between that primary and secondary healthcare, and then fulfilling obviously back through the pharmaceutical. On the mobile application, two quick questions. In Bangladesh, what does that look like? I mean, many I think of our audience perhaps will not be familiar with Bangladesh, but in terms of, say, mobile phone ownership, what does that look like? And also distribution of the app. How do you get people to hear about the app and download the app?
I see. So thank you so much, Matt-san. I think that is a very good question about the Bangladesh mobile. especially in rural area. I think less than 20 to 30% of people is using for the smartphone, which means most of the people is not using. So to be honest, for the first time, we are thinking to provide a mobile application to all of the people in Bangladesh, which meaning just put the mobile application onto the Google Apps or the Apple Store. That doesn't work. I saw that doesn't work. So that's why we decided to provide the mobile application to the pharmacy.
Right. Got it.
According to my research, is most of pharmacy has a smartphone likely. So that's why we are going to provide. Because if patient is using the mobile application, if they have the smartphone, then they are using, they are going to avoid the pharmacy. In future, it could be happen. Then we are not expecting that those pharmacy couldn't be the part of the healthcare system. We need to, we need to utilize. So that's why we are expecting to patient to go to the pharmacy as a primary healthcare system. Then after that, near clinic going to the nearest clinic as a primary health care.
That's great. That's a really good example of sort of looking at the assets in a market and working out how do you use them to increase access to healthcare. I think it's interesting with COVID, actually, I think worldwide, in some markets, and I often think about the UK here, is that the pharmaceutical network is actually becoming more and more important in things like, vaccination centers and flu vaccinations, etc. And as a center for kind of first level, not emergency, but sort of first level health advice. So that's very interesting. We'll come back and ask some more questions in a second. I want to just go back to Ching and ask you kind of a burning question, I think, which is, so you've got this wonderful user journey. You've worked out how to get digitalization happening, how to get doctors to start to use the service that you offer in clinics. Tell us a little bit, though, about the regulatory aspects, and do those vary much? I would assume they do across the markets. Is there encouragement for digitalization of health records? What are the kind of the governmental and regulatory obstacles or encouragement that you're facing?
Right. Thank you. I think if I may break it down into a couple of aspects. So I think we can look at like pre-COVID and after COVID, like how the kind of the attitude or the intentions of the government have kind of like progressed. I think, and the second one, I think it would be just on the system in and of itself. So I think there is the relevant regulations on data security, patient confidentiality, privacy, and the other one is on whether or not like this system is actually legal to be used by a healthcare institution in the local market. Yeah. So I think let's do the pre and COVID comparison. So I think most of the governments, they are already kind of aware that there's an increased adoption from both the provider as well as the consumer or the patient end, like as to, they want to do more things online, registration, like clinic discovery, also management of their own records. So it's that underlying paradigm shift from a provider-centric healthcare delivery model to that of patient-centric healthcare delivery model, and moving away from like going to the doctors when you're sick, when you go to the doctors to keep yourself healthy, right? So it's all these like underpinning paradigm shifts and that the governments are trying to grapple with. So in the markets that we're in, and now we are in 6. So before COVID, I think a lot of the governments, they are kind of like on the fence, or they are like not too sure what to do. It's kind of like it's really difficult to come up with a set of regulations for self-driving car when there are like less than 5 like autonomous car on the road, right? So that's pretty much the case. And like certain countries, of course, like in Indonesia, they cannot take a step and say that like because of the the lower like a ratio of like a physician to a number of like every 100 like people in a country, then just sure that there will be certain challenges and pitfalls when we roll out certain initiative like telehealth, but as a greater good, yeah, like this is an experiment that's worth trying. So some are a lot more progressive, and of course, Singapore, we want to the government want to be the beacon, want to be a role model. The government takes a bit more like cautious approach to like pre-COVID about like how they think about telehealth. But you have like in the Philippines, in Thailand actually, and in Singapore, where they start to think about and also in Brunei actually, they start to think about whether or not they are able to have a national registry of the population's record or the visit record, at least going forward, right? So there are initiatives that either through like carrots or sticks, Singapore was trying to put it into a law, like National Electronic Health Record, like one patient, one record kind of initiative, and most of the public institutions are already on it. And they were like coming down to the private side before they kind of stop for the time being. But similar initiatives we're seeing that in the Philippines, even before COVID, in Thailand, there's kind of like giving incentives to like private hospitals to, sync some of the data to the government repository. And of course, in Brunei, they have the I think Satu Pesakit, Satu record. So it's similar to the slogan of NHR, one patient, one record. So they have that initiative as well. So even pre-COVID, there's a lot of that. But I think the entire since like 12 to like 15, 16 months ago, all these have changed. Because of a lot of concerns and then registration of vaccination, just like keeping ensuring that people are like keeping track of. So you can see that the governments are experimenting more and experimenting with different things, and for the patients, then you can also see in different markets, certain markets, they are more concerned about data privacy. Certain markets, they are like, okay, I just want to leave, right, or not get sick, right? So that we are seeing a lot of this, but definitely I would say that COVID is a tailwind, and it opens up a lot more sandboxes. It opens up a lot of we were also engaged by sort of like state-owned companies from both a public or even like a public, semi-public kind of institutions to say, hey, are you able to do certain things for us? And in this time, we heard a lot about telehealth, but there's actually telepharmacy, there's teleradiology, there's such concept of like a satellite clinic, satellite hospital, because suddenly you have that kind of a restriction on movement of goods, and how are you still able to kind of provide as close to pre-COVID kind of the service and the patient engagement as compared to after. So there's a lot of experiments being done, and of course the second part is just on the system itself. The most for data, in terms of data privacy, data domicile, they just have to be in their jurisdiction where the patient sees the doctor. The provider-patient kind of relationship mostly holds, and in most markets, patient owns the information, not all. And of course, if you talk about China, the Cybersecurity Act stipulates that nothing comes out. So it's kind of like a black hole if the visits are done within the China jurisdiction. So there's a couple other things, but so while that kind of is similar, and if we hold ourselves to probably the GDPR or the HIPAA standards, we are more or less okay on that front. But of course, then the devil's in the details as to how we actually, even down to how we print invoice, how we can be connected with the local social security schemes, and how that will dictate a lot whether or not a system can be actually used legally. I'm not sure if that answered the question. So from
it does.
Yeah.
I mean, clearly it's a very kind of complex area. I mean, I guess one of my takeouts there is it's incredibly complex. It's incredibly bespoke to every market. And you must have had so many learnings through dealing with all of those different parameters in the markets in which you operate.
Yes, and I'm actually really grateful to my team. Like we have the same system for all the market, where we just
that's impressive. You've been able to do that. Yeah, span it so it caters to all those different kind of requirements. Yeah. Hey, great. Listen, I'm going to move us on a little bit. Tell us a little bit about. So clearly, both of you doing some amazing work here. Tell us about the impacts. You know, how do you measure the impact of what you're doing? What sort of measures do you have in place? So whatever you were trying to solve for, and you've had this great vision of really improving healthcare through digital health, how are you measuring it? Yutaro, maybe we could come to you first on that one.
Okay, Matsu-san, thank you so much for the question. I have been thinking about, what is the best answer for the question, then how measuring the success of our service. I think, of course, simply I said about how many people is using, and then how many doctors is using, how many medical facilities using our service. That is simply we can know about how much we could make an impact. I think I'm not thinking about such as, I'm thinking about after 5 years or 10 years. Then if I think about such a long term, maybe how much we could collaborate with pharmaceutical and medical equipment company, medical record system like Hitachi or those kind of big company in Japan case. So because those big picture, it's not only us, it's impossible to create services and then provide making the big impact. So that's why we need to make a collaborate with other business entity as well as government. So that's why after we provide the service and then spreading to Bangladesh's markets, then hopefully we are going to move to other country as well, like India or other South Asia country. But after that, after we collect those kind of patient data, of course we need to utilize. Then we can utilize for the developing the new product of medical equipment like a blood testing machine, or giving those kind of data, utilizing the data. Pharmaceutical company, it's timely they can provide the medicine to the market, or think about to develop and then kinds of R&D as R&D, and then think about the new medicine. Those kind of things we can collaborate together. Yeah. So I think that is the kinds of benchmark or measurement for our success, I believe.
No, that's interesting. Yeah, so you're really looking to how can you make a big impact? How do you really make an impact on the overall healthcare of Bangladesh? A quick other question, are you looking to expand out of Bangladesh, or is, and another question, I should have asked this before, but a Japanese company working in Bangladesh, is that unusual? And how did that happen?
Amasa, sorry, what is the meaning of unusual? Unusual means
it means you're quite rare. There are not many companies from Japan doing what you do or any company in Bangladesh. Is that right?
Right. I got your point. Okay. So yes, we plan to move on to the other market as well, and then probably Southeast Asia, and then especially Indonesia, and then also Malaysia, and then Vietnam. We plan. Yeah. As I say, only our company is a bit difficult to moving on to the other country. Of course, we need to collaborate, but we already had a good collaboration partner in those countries which I mentioned.
Okay. Yeah.
And also unusual is or not. Maybe yes, unusual. That's unusual because most of Japanese company, as well as probably other developed country, some of company in developed country is seeking the market in India first.
Yeah.
Because huge population. Yeah. So that's why some of even Japanese company, medical equipment company has the R&D center in India That is
Yeah.
really good things. They try to get needs from the market in India, but very less. So that's why I'm expecting to Japanese company, not only Japanese company, it's some of company in the developed country is coming to Bangladesh. Because we both together, we need to solve about the problem about this shortage, especially. So that's why by the health management system, not only keeping the recording of the patient, we are also providing and then giving the support by the artificial intelligence, like let's say microbiological test. So there is technology in Japan leading the counting the number of microbiological tests. Then we can also replace to the artificial intelligence, which meaning supporting to the medical technologies, and then connect with doctor in urban area. Then just by the online reading about just giving the prescription and then returning to the rural area that is needed because physical distance is it's impossible to make it short. And then also Bangladesh has a transportation and then infrastructure is still developing now. Yeah. So that's why those kind of online and the artificial intelligence supporting is needed for the medical sector.
Yeah, okay. Okay, thank you. And Ching, get back to sort of measurement. Are you looking in a similar way at your business? So Yutaro, I think we're talking about there are some near-term metrics. I guess that might be for you clinics and reducing costs of operating a clinic. But have you got are you looking at a bigger impact as well over the top of some of those metrics?
Yes, actually. So I would say that although Volkswagen has been around for like slightly more than 8 years now, like we are just getting started. So I think much like probably like a Chinese government, like we have like a 5-year plan. I mean, like Yutaro-san also mentioned that it's like a 5-year, 10-year. So we actually break, in the end, like we always ask like, why do we want to do this and what drives, our team is because we believe that there's a better way to deliver healthcare and that is facilitated, not entirely, but facilitated through technology. And we very much want to be that. And that leads to, like our 2 mission of like building a connected healthcare app ecosystem. And the second one is to power data-driven healthcare. And we happen to believe that we have the strongest mandate as a health system in Southeast Asia to do that. And that's why we build our system to be regional from day one, right? As to the measure, I kind of break it down like into 3 different phases. So the first phase, and this is one that we actually just passed. That's why we say that we're just getting started. Super excited. And is that we want to actually validate ourselves or to have a system that can be, used or be validated by providers in sort of like a substantial number of like Southeast Asian markets, right? So we know that like there's a product market fit in the beginning from a sort of like an electronic medical record perspective. Then the second phase will be, so that's the kind of the initiation or like building the features, enough features so that we are able to put it into most of the markets, and we already have like 80% of whatever all the doctors need and have all the system preference for them to set up, or we are able to actually come up with a streamlined version in each of market, but while all living on, in a more technical term, like on the same branch of the system. Yeah. Right. And to know like all the deploy on either a local system, is it like a local cloud, or it's like an established cloud provider. So that has been done. And with that, like the second phase for us, and we're super excited, will be that connected healthcare app ecosystem, right? So how many labs can be connected to locally, regionally? How many pharmaceutical companies? How many insurance companies? And how many, let's say, labs that you can do? Because all these, like the EMR system is really, you can see as a scale down enterprise plan, like a resource planning system, or it can be a glorified point of sale system, right? So we're kind of somewhere in the middle. We do a little bit of everything. But the idea is that at its ideal state, it actually facilitates all the transactions between the provider or the institution with all the other stakeholders, of course, with patient at the center, but of course, everyone else that we mentioned just now. So the second phase for us is in the different markets, we want to go deeper. We want to increase the number of the clinics. So those are part of the metric. But at the same time, we want to build that connected healthcare app ecosystem. Because if we can do that, we can reach a critical number of like clinics and having that meaningful connection and consolidating all the data back to the patient. Then the third phase is possible where, with the patient's permission, meaningful application can be done on the data and the data points itself. And that is where we are aiming towards, but we know that good things takes time. Yeah, so yeah, we are very patient in terms of just putting things online, and we're making sure that there's a system that most market can use, connect the provider and the patient to all the different stakeholders, then help to the stakeholders make sense of this information. Great.
No, I love this. I mean, I think it's very impressive that you're both have got this bigger goal, bigger vision that you're both aiming at, but you're breaking it down into what are the things, the near-term things we need to build to get to that bigger vision. Super, we're running out of time. I'm just going to take one quick question. Titus asks, are you seeing any future Nigeria or Africa? We've only talked about APAC with both of you. Or any view on partnering with sort of indigenous in-market companies that might be already operating? I think this question is specifically for Africa. Any plans there to branch out of APAC into Africa? Ching, let's go to you first.
Sure. I had the opportunity to spend about a month in Africa before. I think it's a very different market, and it would take, it has its own set of challenges, but also opportunities. But I probably don't have, I know enough to know that I don't know enough. And as I mentioned, our mandate, at least for the next 5 to 10 years, will be in Southeast Asia. This is where I grew up, and this is where I think we can, as Project, can have the most impact. Yeah, so we probably wouldn't look beyond Asia for the time being. Yeah.
Okay. Yeah. Okay. Same question, Yutaro. Any plans for Africa?
Thank you, Matsu. Yes. Answer is yeah. Actually, I'm also the same with Ching-Tse Tseng. I've been to. I haven't been to Africa, but we are looking for the opportunity to making collaborations, and some of the companies are asking us to go with. So that's very interesting things. And then after that, we are just learning about the Africa market, and then how people is struggling in the healthcare sector. And then I could see some common problem which Bangladesh also has, and as well as South Asia countries. So that's why probably that is also, I believe that our product will work in the Africa. But probably we need to concentrate to this South Asia market as well as Southeast Asia countries.
Yeah. Okay. All right. Good. Final question, because we're out of time. But this for you again, Yutaro. It's an interesting one, actually. Is there any plan, or do you sort of export your Bangladesh experience from Bangladesh back to Japan? Is there any reverse transfer of knowledge that's applicable back to Japan?
Right. I was waiting for that question. Of course, yes. Because the problem of the Japanese government, and then I was just looking for some of the statistical number just 1 hour ago, and then 100 sorry, just a moment. So yeah, just looking for. Yes, right. The 417 billion US dollar Japanese government is spending for the healthcare under the Ministry of Health, Labor and Welfare. So that's why I think we don't have time so much. So I simply just straight away I'm going to tell I want to reduce this amount 417 billion US dollar, which is spending for the Japanese citizen. Then that is also facing the same problem in the other developed country as well. So that's the point. So which means in Bangladesh, we'd like to rebuild the healthcare system, which is connecting each medical facility continuity, and then bring those kind of system back to developed country in order to reduce the healthcare cost, like 417 billion US dollar, which is spending by the Japanese government.
Okay, very interesting. Great. Hey, listen, guys, we're out of time. We're going to wrap this session up. So my big thanks to Yutaro and Ching. As always, we've only scratched the surface of this subject, but guys, thanks very much for your insights.
Thank you for having me.
Thank you so much, everyone. Thank you.